from the Princess Bride. Life is pain, and anybody who tells you otherwise is trying to sell you something. Welcome to the Anatomy of Therapy podcast. I'm Dr. John Cebulski here with Bobby Riley. We're starting in heavy already with the conversations before this. We got graphic novels. We got Princess Bride quotes. We're going to go for a little bit something. Holocaust graphic novels. Pulitzer Prize winning Holocaust graphic novels. Mouse, if you're looking for a cool graphic novel. We're also trying to get this done in a good hour today. I got to get to a Champions League final. PSG versus Bayern. Who you taking? Let me know in the comments below. I think that's what you're supposed to say, right? Mm-hmm. But more importantly today, we're going over my man, Kyle Dobbs, also known as Compound Performance _ on Instagram, running 20K plus followers these days. Very consistent on his posts. But what I want to start with today is the comment part of his post, the wording that he wrote, and then we'll go back into his exercises to kind of break down what it is that he means by this. But let me just kind of get through it first. We'll go over here to his page. If you're watching us on YouTube, you'll be able to see it. But if you can't, don't worry. Bobby's great at explaining things. So he starts off, this is Kyle's post, unpopular opinion. Finding obliques, adductors, and glute medians will do more for your tight hip flexors than anything else. Tight is in quotation marks there. Even sagittal ain't sagittal, fam. We'll talk about why he says fam there as well. That's coming from a special person.
ZC.
Zach Couples is right. So if you're listening, Zach, shout out to you, my man. Hope you're enjoying Vegas. We'll come through for a podcast soon. Bilateral glute and hamstring work is fantastic. Don't get me wrong, but it won't help you very much if you can't orientate your rib cage and pelvis with femoral rotation mechanics in gait. Simply put, the pelvis tilts when the femurs can't rotate, and continuously hammering away at muscle groups that are primarily extension and flexion based isn't going to solve a rotational issue as efficiently as addressing muscle groups that allow for increased triplanar competency. Gonna get nerdy here, as if that already wasn't. He goes on to say, the pelvis reciprocally rotates as you walk to allow your femoral rotation throughout both stance and swing phases, while the internal obliques allow for counter stabilization of the rib cage for axial orientation and contralateral reciprocal scapular protraction and retraction during arm swing. We'll explain this later. Bobby will, really. The inability to maintain these relationships often results in rib cage that extends, elevates, and stiffens. This extension results in center of mass displacement, an anterior pelvic tilt, the overuse, concentric orientation, hypertonicity of the hip flexors during gait, and further eccentric orientation of the hamstrings, glutes. Again, like I said, don't go away. But we're going to make sense of all of this very simply. In literally one sentence, Bobby's going to summarize all this. Watch. Dig deeper. The vast majority of movement we perform is on one leg, and we need to think past simple extension and flexion-based relationships. From a performance perspective, extension plus ER equals torque, which is far more optimal for power. Turn those levers into pistons, fam. That's a good line I want to go over to. And then he goes over the 4 exercises he's doing today. So we're calling shifty stuff, kettlebell rotation exercise, Copenhagen's, RFESS with femoral rotation, basically a single leg lunge, and then a dynamic airplane single leg deadlift. Those will be the couple things we go over today. Bobby, going back to this statement, what kind of first hit you in this first finding obliques, adductors, glute medians will do more for your tight hip flexors than anything else? What strikes you first with that?
Well, I don't know if he would completely agree with the way I actually interpret that. I mean, I know what he means. Yeah. I think I know what he means.
Sure.
But in a way, think of something sagittal based. You know, we talked with our friends in the past,
right,
and we talked a lot about things just like straight hip extension, more of these monoplane type of positions for stretching or strengthening.
Sure.
In other words, if you don't get these things, by he's saying finding obliques, adductors, and glute medius will do something for your tight hip flexors.
Mm-hmm.
In my mind, it's like, yeah, things have to work together. There's triplanar, I get it, but I'm thinking if you don't access those things, if you can't, well, then the basic stretch or exercise won't hold anyway. So I'm kind of saying, if you can't access that, if you're not training those things, well, then the basic stretch or the basic movement probably won't keep access to it. So let's say you're trying to work on your hip extension, you're stretching it, and maybe you do, some single leg bridges. And even though that's probably not just one plane, but it's kind of
pretend it is. Yeah.
Yeah. It may give you a percentage of improvement in my mind, but if you're not doing what Kyle, is that his name, right?
Mm-hmm.
Kyle. If you're not doing what Kyle's kind of hinting at here, it's either going to take, in my mind, way longer or way more effort to get the results you're looking for.
Right.
Or it's just not going to hold anyway, or it's not going to be applicable to the movement strategy your body has access to.
Gotcha. So yeah, I mean, we could look at this from that perspective of like achieving a result, and he does talk about this in a number of his other posts. What adaptation are you trying to cause with your movements, with your exercise, with your program? But you're saying people will do these flexion, extension based exercise like stretching your quads. I mean, we've done, the reason I chose this guy, this particular post as well, is because we've done a lot of fix the sagittal plane first. And we've been focusing a lot on these past episodes of fixing the sagittal plane. And his take essentially here, and kind of solidified by yours, is that you can try to get sagittal plane, but it ain't going to stick. It ain't going to stay unless you have these rotational, what he's talking about, obliques, adductors, and glute medius.
Well, it may stick to some point, but it's maybe not very efficacious. It's like,
right.
I mean, I remember when I was, sometimes my most mobile and quite strong was when I was doing martial arts, and I never remember stretching. I just never stretched. But when which
martial arts?
I started with Taekwondo, then I went into jiu-jitsu, then I went into mixed martial arts.
Yeah.
But I mean, I never stretched, but I was very, very flexible and quite strong in all those ranges. And I mean, when you throw a certain kick, you're getting, dynamic, hard IR or ER or, flexion going into extension, going into a rotation when you basically chamber a kick and then do a side kick. So you're getting, you're going from like adduction and ER to abduction and IR and all these dynamic movements. And my hips were the best they've ever been. And I didn't do FRC every day or, so it's like when you use those things, that's kind of what he's hinting here with you don't have to worry about your tight hip flexor so much, because, if you have an adductor that's contributing to internal rotation of a hip and a glute med that's also doing the same thing, obliques that can, like he mentioned below, stabilize a pelvis or rotate a rib cage on a stable hip, then the hip flexors can kind of calm down. They don't have to do all the work. Right. And that's kind of what he was hinting at.
For sure. So wait, back to what you were talking about with your martial arts, because I think if people have been listening, there might be one contradiction, and I'd like you to explain. But we were talking also recently about just move, right? Don't worry about stretching exercises. You just need to move. Just move more. And I know you were probably moving with a lot of intention, obviously, in the martial arts. But does that go against just move more? Because I believe in that podcast kind of ended up, don't just move more, have some sort of plan. But was it just that organically, perhaps it was even your age, or like, what do you mean? Does that contradict just move?
No, it's a really good question. I think it was, at that stage in my life, it's a bit of luck that happened to be very good for me. Right. Because I wouldn't have known what it means to have, great scapular control or glenohumeral ability. I wouldn't have known that. But I've always had, for example, very good hips. Like I can squat very deep with, I can squat with my feet and knees together doesn't matter. And shoulder, never had any major issues with shoulders or anything like that. So when I went into the MMA training or the Brazilian Jiu-Jitsu, it it was a catalyst for good change in my joints. It took something that was already satisfactory and improved them. But this is why your question's so good. I mean, it could have been the same exact situation. Somebody's listening to this and like, oh, I should go do BJJ. Well, if you have a terrible hip, or if you have a terrible shoulder, well, then it may just manifest as injury quite soon. And not to mention, I was listening to Spina on a podcast recently and they were talking about, even if you're not injured, it's amazing. It's good to have these abilities, because they were talking about certain moves that you can't even pull off without the mobility. And it's just something I took for granted back then, that I could do a triangle choke because I have a hip that, hips that were good back then. Right. And it was just a different way of thinking about, an athlete may choose a strategy based on that's the only avenue that they can go down. And we've talked about variability in the past, and the more variability that you have or you can tolerate, that is athleticism, And I've also done powerlifting. My numbers were the highest, but I felt the least athletic. I felt like I could handle the fewest amount of perturbations, the fewest amount of variables thrown at me. I didn't want to pick up basketball against you back then.
Right.
Yeah. So
I mean, yeah. So that's a great explanation of it. You're quite an athlete too. I mean, so I feel like a lot of people, you're probably not going to toot your own horn, but Bobby was an athlete at one point in his life. He's not anymore, but no. So like that increased variability. Let's get back to Kyle. That makes a lot of sense. So let's figure out what he really means when he is saying, so this is the main statement, right? Let's go back to this really quick. That he is going to try to build and refute this whole thing. Finding obliques, adductors, and glute medials will do more for your tight hip flexors than anything else. And generally, tight hip flexors, he's talking about the overall extension, because we know down here he kind of gets into performance perspective, extension EER equals torque, right? And he was talking about back here further eccentric orientation of the hamstrings and glutes. Talking also about, where else was it, how your hip flexors are going to start pulling you forward. So basically, these are going to be techniques to get out of sagittal plane, or a hip flexor extension-based dominant movement pattern, and try to activate some of these obliques, adductors, and glute medials to get out of stuck, I guess is a good way to say it. So this first one, I'll kind of let you jump into it first, Bobby. So basically, Kyle's over here. He's got a pretty heavy kettlebell. I want to say, I don't know, it's a good 50 pounds. He's a big kid. This guy can clearly move some weight. He's got a couple posts where he's deadlifting heavy, squatting heavy. I saw him trap bar deadlift like 400 pounds. He's the strong young man. But this first move is we did a little bit of this actually through Dr. Liebenson's post. It was a little bit wider and a little bit slower, but he's just kind of going back and forth. He's in a wide leg. He's kind of doing a side to side lunge, and he's alternating kettlebells with every hand. So he leans to the left and grabs the kettlebell with his right hand. And then he alternates back and forth. And he's going pretty quick. He's kind of doing this rhythmically. I'm just going to keep this simple for you at first. What muscles is he targeting here? Let's keep this really simple. What do you think that he's feeling with this exercise?
Well, the reason I would do this would be to just open up my hips a ton.
For sure.
But I mean, he's working his glutes in general, glute medials, stretching there's some eccentric adductors going on. I was trying to kind of pick this apart. He definitely looks much better on his right leg.
Yeah, he does. I mean, you can even see, I was picking it apart too. You can even see his, torso opening more back up into the left. Like if he's just part of that PRI fam, where he's just trying to get his torso back into the left, you see his chest goes back into the left, but straight, back into the left, then straight.
But he's not really getting his pelvis over to the left.
He's not really getting his pelvis over to the left either. You can see
And I
his
see
knees.
his left foot is kind of wobbling all over the place, while his right foot is just planted.
You see that left toe just talking to you. It's like it's got a sock puppet down there. That big toe is just waving at you. That's
Yeah.
another cue that his left foot is not grounded. That medial left foot, that big toe is trying to fight to keep him there, basically. But
Yeah.
yeah,
But
so
this one's cool with the opposite. We talked about this. The opposite hand
yeah.
kind of helps promote that torsion, with the opposite pelvis upper trunk rotation, counter rotation, which I think is good, which will help when when you're shifted over to one side and you got the weight on the other side. It'll kind of help, ground you over that leg,
Right.
because what your body wants to do as you, especially in a tight hip, is as you shift over into a hip, your torso is likely to rotate away from it, often because you maybe don't have access to that full capsule.
Right.
He does a good job in his right hip, but in the left, it almost looks like it's video that from one angle, but it almost looks like he extends a little bit, like in his back, because he has to rotate to the right as he goes to his left. And that's why he's like waving his left foot. Maybe he doesn't have as good of IR on that left side, or he's just not able to get into that position. Could be for various reasons.
No, yeah, that left knee kind of wobbles there. And yeah, I mean, I didn't want to pick him apart too much, but like you can tell obviously by his right reach that his right arm just kind of lets go as he reaches. And for that left arm to reach, he kind of has to extend to get that to happen, basically. Either way, with this exercise, let's go over some of the positives of it.
But in a way, like, I'm not picking on him.
No.
I can't do this any better.
Right.
I think it actually highlights his point to discuss where he's kind of missing a little bit of this. And we're just being super picky, but I think it actually highlights the point. What are you trying to get out of this? You're trying to, be able to try planar move over, a pelvis over a hip side to side without requiring lumbar or T-spine extension, without requiring, extension, and able to rotate your torso, being able to, keep your feet down while you do this, which would be indicative of, healthy joints and grounding, like you mentioned. So just being a little picky, I think, can maybe help people understand why you would do this, because when you see where the failure comes, then you can see the point of it.
I absolutely agree. I mean, and by the way, when we say failing, he is not really even failing hard at all. He's doing very well at this exercise. Some of the good reasons I like this exercise, if you were to want to do this exercise, what would be some of the benefits of it? The ability to shift back and forth. One of the things he's talking about later down here, he's talking about this: the pelvis reciprocally rotates as you walk to allow for femoral rotation throughout both stances and swing phases. Let's go to that first part. The pelvis reciprocally rotates as you walk. That is really what is happening, what you can try to get from this. His pelvis is rocking back and forth and back and forth. Is it perfectly ideal? No, that's fine. But there are very few exercises where you're going to get your pelvis to shift that far left and that far right. And just the sheer amount of repetitions, we always, we're into reps and getting things and grooving patterns, but getting that pelvis back and forth, that may be all that he needs to be able to do plenty of, enough of the things. This is kind of his warm up. This is the first exercise in a series. So maybe he's just warming himself up to get into the exercise. But this is really, if you just think about his pelvis going right, left, and then he's managing his rib cage on top of that. So it's just allowing you to almost get unstuck out of just your pelvis right or just your pelvis left by swinging back and forth and kind of cracking it open. That's the main thing that I like about this one.
Yeah, I agree. Look, I like, his mouth looks like it's closed.
Mm-hmm.
So, being able to kind of nasal breathe through this would be, I think, is a good thing.
Absolutely.
Can be indicative of maybe some healthy thoracic position if he's not trying to pull air in extra hard through his mouth.
I've seen that I've seen, yeah. And I've seen, to go to your breathing point, I've seen people do this one a lot slower. And I mean, he's probably using this again for a different purpose, but doing this one a whole lot slower, and then exhaling on one and inhaling on the other arm. And so you can get a little bit nerdy. And then, so that's the way that I usually do this. I'll do this with my feet a bit wider, a bit slower, and I'll exhale with right reach and inhale with left reach. And I'll do that for about 20 breaths. And then I'll switch and I'll go the other way. And that'll really kind of crank open my rib cage. But yeah, any final ones before we go to this?
No, I mean, if you really are not feeling what you're supposed to feel, or one side is off, I would slow this down.
Yeah.
You know, pause in certain positions, maybe even do some pre-work before you get to this exercise. But if you have the joints, you know, you have the ability to do this one, then I think the speed is perfect, because this will maintain that. This will train it. It'll turn it on. Now,
this is one of my favorites. The last one, what reason why I like this one? This is one of my like closers for some of my work, a lot of my workouts, whatever they be, squats or deadlifts or pressing. I've been pressing a lot of weight over my head lately. But this is almost like my total body kind of reset. This is a quick way for me to get out of whatever pattern I've had through my training program, and then kind of clear out my left to right and kind of search for some compensations, breathe through some things, and like to finish this way, because this is kind of ideally, like he was talking about, the way that your body works in gait. So you can train your body, like, you know, Bobby was talking about the power lifts and the big three in the last time. Train your power lifts, do your bench press, do your squat, do your deadlift, but you need to reset your body towards the end of your workout, or at least this is why I like to finish with it, because I'm going to go walking on one leg at a time. I'm going to go reaching one leg at a time. And this kind of gets me back home. That's at least what I feel. But let's go to number 2. And I'll let you kind of start off with this one, Bobby, if you want to. This is a classic, and I feel like we could go a long time on these Copenhagens. But here, our man Kyle is doing a Copenhagen adductor lift with his left leg on a box, and he's on his elbow. He's also got his knee bent. Let me just first ask, like, does the knee bent matter?
Yeah, I mean, it helps for the obliques that he's talking about, for his core. And by flexing the hip up like that and trying to, he's not only adducting the top leg, but that bottom leg that right knee is pulling up towards the sky quite a bit with his right elbow down. So he's basically getting right trunk rotation, kind of on a right leg that's going towards his left.
Right. So like with so right now, if you can't see, his left leg is straight out on a box. His right elbow is down. So it's like a plank, but his foot up on a box, like a classic Copenhagen plank. And his right knee is bent up. I do feel like, especially with that right knee bent up, your pelvis will have the propensity to tip forward, right? So he's keeping his pelvis more stable with that. He's also reaching his opposite arm again, which is going back towards his working on gait through all of these exercises. Biggest things he's probably feeling. Let's just go basic muscle groups. What is probably screaming at him if he's in here, this position for a while? There he is. And we're back.
Yeah, you were gone.
Let's just recut here.
Yeah, pretty much from after I talked, it cut you out.
What did you say? Because I just took off.
I was talking about that right trunk rotation off
gotcha. That's right.
Left stance. Yeah.
Okay. So yeah, you're right with that right trunk rotation. I also think with his knee up and his arm out, like with that knee up, that pelvis has the propensity to want to tip down towards the ground. So he is maintaining a flat kind of frontal plane and not allowing that. It's kind of an anti-rotation exercise with that knee up and that arm out. But first basic questions, let's go, let's keep this, first grade level. You're doing the Copenhagen adductor. What is it he's probably feeling screaming here, primarily. What are the top 3 muscles that the Copenhagen adductor lift is hitting for him?
Maybe an adductor.
Maybe.
Yeah. I mean, an adductor, his abs. He might actually feel his down, like TFL.
Yeah.
Or his glute med anterior. If depends on what that right hip is doing for him.
Sure.
He might feel, his right side, like his right posterior shoulder.
Definitely.
Yeah. I mean, you'll do some of these running marches, in track and field where you're working on, this alternating gait to kind of warm up for sprinting and things like that. He's kind of freezing the frame and, so to speak, flipping it 90 degrees so we're horizontal. But instead of just doing an adductor exercise where you're strengthening an adductor, I like this position because he's trying to say, here's the functional stance in which you need the adductor to do something, which would be to hold you in, for example, left stance, right, while you're doing a bunch of other things. So he's saying an adductor can be strong, but it's kind of irrelevant if it's strong if it doesn't work with the rest of its team, the other players on the team. And so this is more of like a functional position, if we can call it that, where we're training an adductor. I work with soccer and football players here in Iceland, so this exercise is everywhere, but not many people are really taking into account maybe position. They're just, throw their ankle or their knee up on a bench and just pop up. But this is a great way to, like you said, there's anti-rotation in here. There's triplanar. There's transverse plane. This is a great way to modify, even though it's not a huge modification, but it's a great way to modify it.
Yeah, I mean, I think this kind of goes back to his initial, thesis, if you will. Finding obliques, adductors, and glute meds will do more for your tight hip flexors than anything else. So in this one, while his bottom leg, his right leg is flexed up, his top leg, that top leg for the Copenhagen adductor, where his adductor is screaming, is closer to extension, i.e. not hip flexion. And so this adductors, although his hip is not properly fully extended, like beyond his midline, if you will, those adductors are starting to scream and inhibit the hip flexors, which will ultimately allow for more hip extension. I think that's where this is kind of fitting into his thesis. So you're not seeing hip extension fully here. You're seeing hip flexion, and then maybe more of a neutral kind of leg there with that top leg. But those adductors will help you get hip extension. It sounds a little bit weird to hear you say, but like the adductors definitely will help you get hip extension. Yeah. Awesome.
Yeah.
Cool. Let's move on to the next one. Kyle, what do we got? What do we have for this last one? Okay. This one gets a little bit interesting. So with this one, we've got kind of a single leg lunge. What is a Bulgarian split squat, right?
Front foot elevated.
Front foot elevated, rear foot elevated.
Oh, yeah.
They're both elevated. The back leg's elevated a little bit higher. He's got one of those cool roller machines where his leg is probably feeling comfortable. A lot of people put it up on a table or something. And also his front foot is on a block. I don't know, maybe 4-6 inches elevated, so that his back knee, when he flexes down, kind of in a hip flexor stretch position, you might think, his knee goes below his front foot in this. He also talks about, as he's doing this one, he kind of talks about it down at the bottom here. This is the third one, RFE, rear foot elevated, single leg with femoral rotation, not thoracic rotation. So he's actively trying to keep his chest, his spine straight as those hips kind of twist, the femurs twist. I guess he's also trying to keep his pelvis and his rib cage still, yeah, as those femurs kind of go back and forth, up and down. What do you first see with this one, Bobby?
I'm waiting to hear your talk on this one
Oh
actually,
God.
because I mean, to me,
Yeah,
it's
sure.
I do something similar a lot. I like it. I don't know,
Oh.
it's this one.
You were trying to
Um,
figure out why this was meaningful. I think this
well, I
was.
mean, it fits in with exactly everything he's saying, but I don't
Yep.
really have as much to comment on it.
No, that's fine. I think this is a little bit more. I like this one because it makes active that hip flexor stretch. This is the quickest thing I can come up with, basically, because it goes into the hip flexor stretch and then right out. And as he's doing this, he's kind of doing it rhythmically. It's obviously kind of on a loop for the video, so he's obviously not doing it 5,000 times like you're seeing on the video right
This
now.
is live.
This is live. Kyle is doing this. He's one of those poor test subjects who's just going to be smoked while we talk about it. But no, like going into this is back to what you said in the very beginning. Those stretches that don't stick, you have to do your hip flexor stretch every single time, and you feel like you're not really making progress. You do your hip flexor stretch, you go to practice, you go work out, and then you feel like, you could do it again at the end of your session, or you're going to have to do it the next day at the beginning. And it's not really going to be any different. It's still going to be brutal and tight. You're really not making progress on it.
Why do you think he said not thoracic rotation? Why do you think he's actively, I'm just curious what you think.
I hope that he's thinking not to get, I really don't know why he would say that. Like, I guess he's just trying to keep his hip flexors off. He's trying to keep a quote unquote neutral thorax and pelvis over the moving extremities, the arms and the femurs, the humerus and the femurs.
It makes a little sense for the legs.
Yeah.
But I'm wondering, yeah, maybe that was his goal, but I'm wondering why, arms moving without thoracic rotation is kind of false arm movement. You know what I mean?
Sure.
As far as gait goes.
True. I think it's a little bit of a reach. There's also thoracic rotation is just very popular. Perhaps he's thinking about the unscrewing mechanism of the thoracic spine staying still and those hips and femurs twisting from below. I'm not quite sure. This one was also just a little bit of reach. I only really like this one for the repetitive nature of it. I really did. People that sit down, like our friend Steve, our big friend Steve. He is a big fella, but our friend Steve, who loves the hip flexor wall stretch, and even Askey talked about it a couple episodes back. Go listen to those. But, the static stretch of those, and this makes it just more active. And I think sticks better in my mind.
I know you like this movement too. I've seen you post, you on some hip extension machines, but using them, or are they curl machines, or what are you using to do this?
It was a leg curl machine. Yeah, I think I've posted that on our page a long time ago.
Yeah, where you're getting that kind of long eccentric quad stretch, and then you're firing the quad from that position. Right. Kind of what he's doing right here. Yep. You could put the emphasis. He looks to be kind of balancing it between the front and back. He looks like he's using his back leg.
Agreed.
You could focus on a front leg. You could focus on the back leg. You could focus on trying to keep it 50-50 on this. I mean, if you shift more over the front leg, you're going to kill that left leg.
For sure.
You're going to shift, if you're going to try to do a lot of coming up from the knee off the floor using the back leg, right, that's going to be killer for that leg. So, I mean, you could place the emphasis in different points on this one, but I think like your guess for the no thoracic rotation was fair. He's just centered, pelvis and femur focus here.
Right. I also think the other piece that, just knowing the group that he kind of runs in, that this, lunging down to the vision, I do believe you're right. He is more on that right side. You can see that right leg doing more work. But the group of people that he likes to hang out with really like to get the left hip to sit back into the socket. They're very much trying to get that left femur to internally rotate and extend, pushing into the posterior inferior capsule. So he kind of feels like a deep glute stretch. I think that's why his the forefoot is elevated. They're both elevated, but I think they're elevated so that he can sink a little bit lower into that left hip. I know these guys are kind of obsessed with that. and it's a fine obsession, but I really think he's trying to jam his left femur back. I don't think he's doing a great job of it, but like, I think that's
No,
the idea.
if you did a retro stare with thoracic rotation, you would probably feel it quite a bit more.
Correct.
If that was your sole goal.
If that's his sole goal, again, I don't think his sole goal might be for reps. He could have a totally different goal for this, but I think getting that left femur to sink way back down into the hip and then have that right femur in extension help pull that left hip back and not get that any other way, meaning not getting thoracic extension to get that, just the hips by themselves, I think is kind of the main thrust of this one.
Yeah, and it's at least better than the spine extension machine in the gym. So
right. I mean, and so like when you're talking about like, okay, so not thoracic extension, I know that if you're lifting heavy, right, like you don't want that thoracic, or what would you not want thoracic rotation for? Because thoracic rotation is a big one out there that people try to get a lot. But like, you know, you don't want a ton of thoracic rotation through, I think, a lot of these performative sports. You still need to build some of the torque and twist through that torso, no?
yeah, I mean, like you said, you still have to have strength in anti-rotation or resisting torsion. I mean, you know, can't fire can't fire a cannon off of a canoe, right?
Sure.
So, I mean, you still need to be able to stabilize your thorax when needed. If it's just, you know, Gumby, well, that's not going to really be helpful for generating force either. So,
right. No, I agree.
But I mean, you don't, like for running, for example, and it's kind of, you know, we can go to these courses and we study gait and we need the right shoulder to go lower and we swing and we get into mid stance. And then but when you watch somebody win the Olympics or we watched this 5K just get broken a few days ago. I don't know if you saw this.
Wait, what was this?
It's like a 16-year-old record.
Breaking news.
World record was broken in the 5,000 meter run. Yeah.
What was the time? Do you remember the time?
12:36. Yeah.
Jeez.
12:35.6 or something like that. Yeah. They were all 60 seconds laps, except 12 laps, I believe.
Right?
Yeah. They were all 60-second laps, except for one was 61, and then two were like 59 flat.
That's so crazy.
That's blazing. But anyway,
sorry,
my
what were you
point
saying about it?
Yeah, you watch these marathon runners or these distance runners, and I mean, they have some oscillations, some mild rotation, but a lot of times they're locked in. Their head is not bobbing side to side like we study in gait class or gait training sometimes.
Right.
So, I mean, it depends on the sport, but there's a time when you need appendages to move on a stable thorax.
Sure.
And there's a time when you need to be able to let that go, which is kind of what you were hinting at with a power lifter. I mean, if you did 30 sets of bench press with a slingshot on and wrist wraps and elbow wraps and mud vein, well, then you may want to sit in a deep squat and breathe and listen to Beethoven before you leave. You know what I mean?
Right. No, that makes sense. The other part about, like, actually I was thinking about this one in terms of, you had messaged me earlier this week about a patient that you'd only seen kind of initially, and you was basically, it's like some low right back pain. There were a couple other pieces we could get into maybe, but I was thinking about this just not exactly that this was the fix for your patient, but how many low backs I fixed by fixing thoracic rotation. And there are reasons why, you know, I've tried to get thoracic rotation first. Sometimes it's just easier to fix for me on a certain type of patient than it is trying to get someone's hips correct. And it just depends on the type of person, where they are in life, their conditioning, where I'm just trying to get them out of pain and get them back to life. And I feel like a lot of thoracic rotation will fix that. So like your right low back pain patient, there are a couple tests I'll do, and if I see that they are bad enough, I'll just fix right thoracic rotation, left thoracic rotation, and I feel like I can kind of get that quicker and keep that quicker than some of the nuance it takes to get someone's hips right, if that makes any sense. They're a little bit harder to fix than thoracic rotation, but I also understand once you've got that, there is thoracic rotation component that is also hurting your back, i.e. you don't have it or you have it out of control via your arm swing. And so once I can give them thoracic rotation, if I can get them to control the thoracic rotation, because a lot of people, when they'll get some rotation, they'll just kind of whip their torso, their elbows kind of back and forth out of control. And if I can add some control, this would be very advanced, maintaining your thoracic rotation by not thoracic rotating, because it would be very easy to twist back and forth. You'll just kind of find that you do. A lot of people do this with their squat. Actually, Steve said this many years ago when we were first starting. He was talking about corkscrewing down into a squat, and that being your shoulders and thoracic rotation problem, and that'll crank on a back. And we're very obsessed with fixing hips in this thing, but there are many times when your thoracic rotation or your inability to control your thoracic rotation is adding torque from a top down as a top down mechanism.
Mm-hmm.
You were talking about some other things with your patient, but for whatever reason, that kind of just popped up. And do you know what I'm talking about there?
Sure. And I was thinking also asymmetrical thoracic rotation is big. And I find that I personally believe that that's the main reason for these call them rib subluxations if you want, rib trigger points, that pain between the spine and the medial border of the scapula. I tend to see these in issues of asymmetrical thoracic rotation. So they can rotate phenomenally one way and they can't the other way. And that asymmetry causes basically a shear through a certain portion of the rib cage where they rotate at. And that shear is costovertebral junction pain. You know what I mean? And those things hurt. Those are highly innervated. So you get, and then you get muscle spasms on top. And I would say half of those people that come in, they come in with neck because their neck hurts. And then I can kind of check their neck and I'm like, no, your neck's fine. And then you go down and start poking in the medial border and it's just like a 9 out of 10, you know, I feel like I'm poking them with a knife and I'm just gently pressing my thumb in there or fingers. But anyway, that's just like a counterpoint, you know, or a side point to that idea.
No, it's perfect. I used to, this will go back to, actually, I want to kind of go back to his Copenhagen adductor with this, because we were talking about the medial border rhomboid pain before, and we never really got very deep onto it. But while it's on the top of my tongue, let's kind of get back to it. I used to be obsessed with loading my changes before the patient got off the table. Because remember, we've talked about it so many times where you may be able to make a change with your hands or your cups or your Theraguns or your needles. And then the patient walks down the hall, you know, reaches down for their phone and immediately kind of undoes what you did. So I was a little bit, this is a long time ago, pretty obsessed with, if I did make any changes with my hands or stretches on the table or whatever, before they got up and did anything, I would make them do some sort of exercise on the table to reload what I wanted. And I was very obsessed with making people do planks. You know, they would be laying on their stomach and I would rip apart their rhomboids or whatever because they had that medial border pain, levator pain. And then I would make them do a plank. And then I would kind of cue their rib cage and kind of, you know, move your rib cage up here, move it down there, move it up and down. And then I would have them shift over to do a one-arm plank. And you would just have to hold it up on one arm for like one breath, really just to load up the back of that shoulder, load up your rib cage. But ultimately, I would have them doing a plank to a one-arm plank. And then if you could, and a lot of people can get to this, it would be to go to a side plank, to move from a plank, shifting over to your right arm, keeping your torso kind of and torso and scapula kind of together, and then opening up to like a side plank. If you could kind of control that mechanism, and it didn't take much once you kind of coached them through it, and then you lay down, I could work on you, and you do that again. If you could kind of control that through your thoracic rotation, through stabilizing your shoulder, I felt good about maintaining my treatment. That, I think, is kind of that anti-thoracic rotation is what my man is getting here with this Copenhagen adductor, right? So yes, he is getting a lot of adductor. That's what the dang exercise is called. But his right shoulder is probably smoked. You see his left shoulder reaching and his right leg up like that. So there is the propensity to kind of twist and turn. So you may not know it, but this left adductor is stabilizing his left pubic symphysis, his left pelvis, in order, and then ultimately with the back of his right shoulder for counter rotation of his torso. So this is a thoracic anti-rotation exercise, if you will. But it's just saying that anti-rotation is locked up at the left pelvis specifically. And the kind of group that he runs in, they believe that left leg, that left pelvis, that left femur is one of the big inroads into stabilizing the system. There's a big weak link at that left leg, kind of what we were talking about in this first exercise, where Kyle was having a perfect time getting over this left leg. That's his idea. So maybe he, in this first exercise with the kettlebell going back and forth, lunging left to right, he goes, you know what? I'm not feeling like I can get into my left hip very well. I can see my big toe is waving at the camera here. Let's go over to that Copenhagen adductor exercise and stabilize this left hip a little bit better because it wasn't doing so hot on that other side. That's how we get from medial border pain all the way to the left adductor.
Mm-hmm.
But do you see? Not do you see? Of course you see what I'm saying. Let's go back to the planks and the stabilizing of thoracic rotation, because I think that's a big one. Even just having people kind of go back and forth, you know, your general aunt and uncle come in to get treated, right? Your next door neighbor, a little older and deconditioned, they've got that medial border pain. Work on it how you work on it, massage it, adjust it, but see if they can't do a plank. Even I let them go from their knees. I'm not really trying to smoke their abs, but see if they can't maintain that rib cage as they kind of shift over into the plank, left versus right. You can do it on a side plank. You can do it on a Copenhagen adductor like Kyle does, but you'll have to, again, cue them. I think it's a little bit tougher in that position. So depending on who you have, see if they can maintain that rib cage position over a stable shoulder. Does that make sense?
Yeah, I mean, this one that we're showing you, I think, would be primarily for athletes, to be honest.
For sure.
Otherwise, I like the approach that you've been talking about for most people's general patients. That's a great reassessment.
But let's get to this final one. And we did a bit of this on our last guy with Dr. Liebenson and the way that he talks about single leg deadlifts. But this is there's a little bit more involved dynamic airplane single leg deadlift. What makes this dynamic, Bobby?
Well, he's moving.
Is that why you think he said it's dynamic?
Yeah, well, that's what the word dynamic means.
I mean, yeah, of course.
But he's moving. Yeah, it's synchronizing all the things that he's probably trying to get out of this. In other words, as opposed to just getting in a position and holding it.
Right, that's fair. He's also doing a good bit of twisting. We went from not thoracic rotation to getting left thoracic rotation. I feel like he's got his left hands on the bottom of his left fingers on the bottom of his left ribs. And it seems like he's trying to monitor those to move back, down, back, and in, as they like to say, on the left side as his right side reaches. And as he shifts his weight back into his left hip.
Yeah, this one you should get a little bit more left posterior hip capsule or outer posterior hip capsule on this one compared to that other one.
Yeah, absolutely. And he's going at such a pace. We've talked about pace with a couple of these. He's going at such a pace where you could tell he's probably sinking into that right hip a little bit more too. He's still getting a little bit of that left leg kind of going back and forth. I think that left big toe is still kind of popping up. You can see that knee going back and forth, but he's really trying to reach his right arm, shift his weight back into his left hip, and then he kind of pops out of it as well. This, again, he's talking about what things are still and what things are mobile here. Essentially, he's trying to move that left pelvis over this femur, right?
Yeah. I was just thinking I would have put this one maybe in the beginning.
Yeah.
Where it's slow, it's controlled. He is, for example, we kind of picked on him for the first exercise on his left hip. This might have been, I don't know if he just put these in a random order, but in my mind, this one might be great to move up to number one, to get those capsules open and get that hip, him starting to feel that pelvis going over his left femur while he keeps that. Yeah, I just saw him there struggling to keep his medial border of his foot down.
Right.
I'm wondering if he, just based on long-term orientation, if he has more issues with that left hip. Not pathological, but just positional.
Sure. The active or dynamic. I want to ask you about this because I actually don't follow couples, or I've stopped following couples over the last year or two, to understand what he means by turn those levers into pistons. Fam. Zach Couples always says fam, and so this is where he gets it from. But what does he mean by turning? I honestly don't know. What does he mean by turn those levers into pistons?
I mean, I don't know either. That guy puts out, I'm not his brother or family member. I can't devote all my time to his content that he puts out. But my guess is that without proper position, without core control, without this stacked pelvis, stacked thorax on a, or a diaphragm on a pelvic diaphragm, without good position, you can't create power in these in the extremities. So I'm guessing he's referring to pistons, like the leg being powerful enough to explode, to drive, to create torque, to create power, to create energy, without proper position, without stability coming from the core. I think that's what he's referring to.
Yeah, no, you're going back to your shooting canoes out of whatever pit. What is
shooting canoes out of cannons?
Cannons out of canoes. Canoes out of cannons. Thanks, Dr. McGill. I heard Cressy say that a bunch recently. Actually, it's all intermixed there. But anyways,
we should post it. You can't shoot cannons, canoes out of cannons. Dr. Stuart McGill.
Literally, you
just
cannot
throw him under the bus.
Good luck trying to just make a very special cannon for that canoe. But obviously, so you have to, so like pistons and levers. I was thinking again, kind of let's go back to your patient with right low back pain. There is a lever, I would guess, a compressive factor in his right low back. And instead of there's too much movement in his right low back. You were talking about the cluneal nerve. I always mess that one up, but right at the border or the edge of the pelvis where it goes towards the low back, that kind of turning point. People are like, that little bump right there on the back of your pelvis, that near there. But through there being a transition zone, a lever that is taking too much compressive force for whatever reason, locking that down and turning that area that is the cannon taking a shot, but turning that into a very stable area from which the cannon can then explode on, because that little piece would be part of the torso, which should be stable, should not be rotating through these big primary movements. But for whatever reason, that low back has started to move way too much. So we need to decompress, and we need to find something else to take up the slack for that movement. I really don't know. I wish I will. Maybe we'll get Zach on here to explain what the difference between pistons and levers are. I'm sure there's a wonderful analogy there. But so back to these exercises. I shudder to think that he's put these here for any more or less special reason, one versus another. I'm just gonna say he's just kind of put these exercises up without any specific order. And maybe they're perfectly ordered. If you had to order these exercises, Where would you start and why?
I think it depends on the patient. I just said that for him specifically.
Yeah, let's stick for him and his wobbly
I
left
mean,
foot.
yeah, I just would have thrown, number 4 before number 1.
Yep.
And maybe it goes 4 and 1, just like that. And then, I don't know where I would put the Copenhagen, to be honest, but I do like, number 3, maybe, maybe 3, it goes 4, 1, 3.
Yeah.
I don't really know where you put Copenhagen. And then it might actually add one where he's doing something that isn't an exercise. It's more like some sprints or some running or some hills, or, just something that is truly functional.
Right.
By definition, because that's how we actually, I mean, I don't know anybody 100,000 years ago that was doing a torsional Copenhagen plank. So
for sure. Okay. So this would be my reasoning. This is my record. I think you're right. I think 4 is first. I think we try to isolate things on one foot. See if you can get into proper full left stance early, late. So you can feel your left foot grounded. You can feel your left hamstring. You can feel your left glute. It's going to be a little bit harder to feel your obliques on this one. There's not probably enough weight or torsion on this dynamic hip airplane. But I would do it. It says dynamic. I honestly think the first one with the kettlebell is a little bit more dynamic. Dynamic just means it is moving, but this is the most slow and controlled one. So I would do this on the left versus the right, a slow, feel your left foot, feel your left hip, right? And feel you can move in and out of it. Then we'll do it left and right. Then most likely, I mean, I would probably, the next advancement would be probably this third one, the rear foot elevated SS with femoral rotation, not. So like he's doing it a little slower. Now he's doing it a little bit faster, maybe, right? He's doing it with a little bit more repetition. And then, the Copenhagen's, which one of these things doesn't belong here, isn't that similar. But then I would go back to this first one, this kind of rotational kettlebell, half squat, half hinge action. So he's done the dynamic airplane nice and slow. He can feel that he can get into his left hip, his right hip. Then he does it a little bit faster, a little bit more repetition with the rear foot elevated. Then he finishes adding in some tension from the top. So basically he's staying low enough, I think, in this kettlebell kind of switch foot back and forth to kind of maintain some tension through the hips, right? And now he's adding in the extra component of thoracic rotation up top, where he wasn't doing thoracic rotation at the end. I guess the Copenhagen adductor would have to be last, just if he was like, man, I just cannot seem to get my left leg centered. I really need to find a way to fire off my left adductor.
Or counter rotation. He doesn't.
Yeah.
I guess he does it a little bit on number 3, but
the counter rotation. Yeah.
Yeah. But he's saying don't rotate. So the Copenhagen is really, even though it looks like a stability, neutrality exercise, might be the most counter rotation thing he's doing out of these 4.
That's true. That's very true. But then with back to that first kettlebell rotation one, he's allowing himself to rotate, but I don't really think he's rotating that left forward. Anyways, either way, I do think in terms of creating kind of a warm-up program, and again, we don't know the context or situation for what he's talking about. If I was to do it, I would start kind of slow and steady, find and feel, and then kind of build upon that, at making it more dynamic, adding more torque and tension, or changing the load and variability with that rear foot elevated. I think that Copenhagen is there just for fun, or just kind of, one of the little side things he's working on. But that basic idea is where I would kind of work. Is that reasonable?
Yeah. That all made sense.
Fantastic.
Yeah. So basically we would have just done it better, but we didn't post that at all. So
no.
And just kidding, any harsh words is just us being critical, because we get to just sit and pick it apart. But it was a brilliant post, actually. I thought when you sent it to me, I was like, this is a great find. I like a lot of things about this post. I don't even follow him, so I will have to start.
No, he's great. And like, I think a lot of the tricky stuff that he said within the post, you know, he's talking about rotating the pelvis. I think that can lose a lot of people, but I'm a big fan, and I know you are as well, of kind of doing, you know, I'm a very kinesthetic learner. So if you feel like a lot of this stuff kind of is missing, you're like, I don't really know what he's saying with this Copenhagen adductor thing, how it's a rotational deal. Go to the gym, put your foot up on a bench, lift your bottom leg up like we were talking about, like Kyle was doing. Go follow Kyle if you don't already, if you're not one of the 20,000 people that follow him, and try some of these and feel what we're talking about, or don't feel it. See how hard it is to not let your left leg, you know, big toe kind of wobble on a single leg deadlift, because it's not easy. And I feel like a lot of these positions, like that first dynamic one, you know, going back and forth, we talked a little bit about this with the Craig Liebenson one, about the amount of coaching that we do, should or shouldn't do through an exercise. And I think Craig is right. Do the least amount possible, and then let the exercise kind of coach them. You know, ask them to kind of find and feel certain things. And if they don't, you can help them feel and engage their left hip, or you can show them why they're not, why that left toe keeps popping up. Go do some of this stuff that Kyle's out there doing. And if you follow his page, you'll see that he's doing a lot of this stuff very frequently, along with lifting stuff heavy. But I know doing would be a big way to start learning this stuff as well. Yeah. What was of all of these, if you had to have people do one, general population, which one are they going to do? Just to work on, you know, every time you go to the gym, I would just work on this one. Or is it even not one of these exercises? You have to, I'm going to limit you to one of these bad boys. Which one of these ones would you have the majority of the population work
on? I mean, not the Copenhagen, to be honest. Yeah. I don't know. I really, there's something I like a lot about number one, but with the split stance position of the last two, I would maybe go from 3 or 4, but I do really like number one a lot.
Yeah.
So, I mean, I don't know. I mean, again, it always depends on the patient. It depends on the individual.
Sure.
But honestly, if they're doing any of these, I mean, you go into a gym, there's just a lot of, you know, leg extensions. And I mean, the gym I go to got some curl, you know, ab curl machines. Those things are always in business.
Right.
And so if you're doing any of these, it would probably be beneficial. But I do like your recommendation of, you know, we've talked about this in the past, you know, bringing up Richard Feynman and discovering your own problems first and trying to solve them and feeling these things. And I mean, I was a thrower in track and field. I don't know how I could coach that sport. I have no idea how I could coach that sport if I never threw.
Right.
I mean, I could watch videos endlessly and read every book that was ever written on throwing. But if you don't throw, if you don't have a history of throwing, you're just going to miss things, don't see things, can't relate to the athlete. Right. So if you're somebody who's advising lots of athletes and you never were one and you don't train, I don't know. It's possible. It's possible that you could just be that dedicated and smart and figure things out. And in some ways you might look outside the box and that's helpful, but there is something to be said about doing it yourself that you can't really recreate by studying more or reading more literature.
I think that's a perfect way to end this show. Go find a compound, go follow. I can't talk today. It's the coffees. Go follow Compound Performance. Go say hello to Kyle Dobbs. Do some single leg stuff. Try to get extension not via the sagittal plane. That's the challenge. Go do stuff. And tell your friends. Peace.